Thank you for your interest in the work of Southeastern Michigan Health Association, also known as SEMHA. At SEMHA, within our Health Equity Division, we are dedicated to fostering and facilitating sustainable initiatives that promote health equity, well-being, and operational effectiveness. Our strategic partnerships are aligned with our objectives, enabling us to develop plans and strategies that cultivate environments where individuals and communities can thrive. To illustrate the value of collaboration, we've commissioned a series of interviews featuring our partners in Detroit and the Southeastern Michigan region. The SEMHA Leadership Through Partnership series will highlight how individual efforts, when integrated with strategic and aligned partnerships, can enhance each organization's capacity for impact and drive meaningful change within their communities. This video series is a part of our ongoing Health Equity Quarterly newsletter. Thank you for watching, and we hope you enjoy the presentations. Thank you. Good afternoon, Nikki. How are you?
Good afternoon. I'm doing well, Arthur. How are you?
I'm fantastic. You know what? I'm really looking forward to this conversation today as we look into what COTS is doing in Detroit, as well as talking about the SEMHA Regional Health Collaborative, which you guys are partners of. So first and foremost, tell us who you are and tell us what you do and tell us who you do it for.
Sure. So my name is Nikki Carbonari, and I'm the Executive Director of Impact at COTS. And COTS began in 1982. Originally, our name, COTS, stood for Coalition on Temporary Shelter. We actually recently changed that, and so we just go by COTS now, but our slogan is Creating Opportunities to Succeed. And so COTS supports families who are experiencing or at risk of homelessness. We operate a families-only emergency shelter, and then we develop housing as well, subsidized housing. We have about 250 units in Detroit of housing, mostly for families. Our focus is on that 2-generation, supporting adults and children as they navigate homelessness and eventually become self-sufficient.
Amazing. That really sounds exciting. What brought you guys to the SEMHA Regional Health Collaborative? That is a big, kind of sprawling collaborative. What's the RHC?
So we really value partnerships at COTS. In all the different areas that we work, we understand that we have to have partners to support our families. We cannot do this in a silo. And so we partner with many people, and we got involved with this collaborative through Lisa Braddock's. Knowing her, she's been involved with COTS, she's volunteered at COTS. So she invited me to come to, I believe the first meeting or one of the early on meetings, to be a partner in this work. And it's very important for us. I mean, COTS sits in the homelessness arena, but it's very important for us to be involved in healthcare discussions and discussions about equity. What does equity in healthcare look like, especially for people experiencing homelessness? So the collaborative is a great opportunity to have that ecosystem discussion where we're talking about truly serving the community, because so many of the partners in the room overlap in the people that we serve. And so it's great to have one space where we're talking, about how can we help people get access, get continual services, really just meet their needs.
Wow, that's amazing. So my kind of follow-up question to that is, how has being a partner really impacted the work of COTS? Has it helped? Has it supported? Has it catalyzed? How has being a part of RHC, Regional Health Collaborative, how has it really impacted your work there?
Well, a part of our mission is to advocate for long-term solutions to homelessness and poverty. And so while COTS is majority a direct service organization where we're really providing those services on the ground, we also do look for ways that we can advocate and look at the big picture. And so the Regional Health Collaborative has been really advantageous in that space. So looking at the big picture of how can we help people, how can we look at social determinants of health and really work on more of a preventative space for people before they actually start experiencing homelessness? How can we help intervene before they get to that place where they're actually at COTS stores? And so a lot of our discussions right now are still, we're still sort of in the beginning stages of really like taking action with our collaborative, but it's been a great space to learn about different resources, to see who's in the room, and I've created a few partnerships just with other people in the room. So it's been a great collaborative space.
That really, really, it's like you're reading my list of questions here. That leads me to my next question, because the Regional Health Collaborative is uh, a iteration of the shires and the shire work, and the community information exchange. And so these ideas were really mechanized around tearing down barriers and eliminating the walls, and getting rid of silos that prevent people from getting seamless service or interoperable service from the healthcare provider to the community, to to their pharmacy, being sure that there's a closed loop. Can you kind of talk to us a little bit about how the RSC addresses silos and gaps between social care and community organizations, healthcare, and public health?
Yeah, I mean, right now we are very siloed from healthcare, in particular. I mean, the homelessness, we have our own continuum of care between service providers in the housing and homelessness field, and then healthcare kind of has their own as well. So it's great that we're even having these discussions about merging the two, and seeing how we can have more cross disciplinary discussions. Because at the end of the day, that's really what's going to help the families that we serve. It's difficult for them navigating so many different systems and having to share their information and their story again and again. And if the providers can be on the same page, and the providers can know what the family needs, it's just going to be such a better safety net, and really just a better way to support the family and help them in the long run.
This question sparked something else for me, and if you feel comfortable answering, this is a new question, because this is also a community health worker project where we're really looking to how we can leverage community health workers in filling some of these gaps in the system. How do you see community health workers helping fill the gaps as it relates to housing in Detroit?
Mhm. Yeah, I think, well, as far as connection to healthcare and health resources, absolutely. They play a really big role. Um, we see so many of our families struggle with access to healthcare, whether it's behavioral healthcare, primary healthcare, healthcare for their children. Again, we serve families only, so we have a lot of children in our programming, children with disabilities or special needs. So there is a lot of need for access to healthcare. As far as housing goes, and housing is very tricky right now, to be honest with you. I mean, we are in a deep housing crisis. I mean, really all across the country. It's not unique to Detroit. Everywhere is experiencing these housing crises, but it is hitting us very hard in Detroit. We can see it in the shelter, and the number of people who are trying to access shelter, and even the rates, how long it's taking people to find housing when they're in our shelter. So there's a role for everybody to play in that, and even just bringing awareness to the need for more affordable housing in the city is really important.
Thank you. Uh, the next one is, as we kind of push toward to the last question, is also very important with everything that you shared about the scarcity of housing and scarcity of resources. Uh, how can closing that loop in service coordination improve the client experience? How can it improve their health outcomes? If we keep hearing about closed loop and interoperability, and kind of all the things about connection. So how can closing the loop really improve service coordination for those we serve?
Well, it absolutely can. I think a lot of times these systems that our families have to navigate can cause trauma, really. Like we have so many families who are experiencing trauma, and sometimes that trauma is perpetuated by the systems, the different, just navigating all the different systems and the waiting and the miscommunication, and there's just a lot, a lot going on that a family experiences. So the closer that the providers can work together, this closed loop system, really ensuring that all the needs are met, it's just going to be such a better experience for every family.
Thank you for that. And so, in our last question, um, I just want to hear more about how we can, or how the community more broadly can support the work of COTS. Is there, upcoming fundraiser, community engaged outreach? How can the community support and engage COTS?
Well, absolutely. We would love for you to get involved in COTS. You can check out our website, which is www.cotsdetroit.org. We do have an upcoming fundraiser. It's our signature fundraiser, which is Soup City. It's a third Thursday in January, so a few months to prepare for it. But it is going to be at the Rooster Tail in Detroit. It's a great event. On our website, you can find more information. We also have different volunteer opportunities, which are on our website, partnership opportunities, which again are on our website, but you can also reach out to me directly or through Arthur, who can connect you to me as far as partnership goes. But yeah, absolutely. We encourage everyone to get involved with COTS, and then also just to educate yourself, become more aware, about what's going on with housing and healthcare in the city.
Okay, last question, another surprise for you.
Okay.
What's it like to partner with SEMHA?
Great partnering with SEMHA. You all are really like the backbone for this collaborative. So you're the ones organizing and doing like all the facilitation. So yeah, it's been great working with you all. I'm really happy to be around the table. There's so many great partners that are included. So yeah, it's been great.
Okay. Well, I just want to thank you so much for your time. I tell you, it's always a joy talking to you and really learning more and more about the work that COTS is doing, serving our residents in Detroit. And then, do you guys do anything regional, or is it Detroit specifically?
It's Detroit. It's all Wayne County. We have some housing in outside of Detroit, but it's all within Wayne County.
Okay. All right. Well, thank you so much for your time today. Look forward to posting this information on YouTube.
Good. Great. Thanks, Arthur.
All right. Have a great day.